much for joining us today for this webinar on stress management presented by Dr. Eric Secor of Hartford Healthcare. I would also like to thank Peter Jesse of Hartford Healthcare for this collaboration and helping us put together this presentation. Before we get started, please double check that you are muted to avoid any interruptions during the presentation. If you have any questions throughout the presentation, please type them into the chat as I will be monitoring them. Following the presentation, Dr. Secor will be answering any questions you might have. And any questions you have about the Fitness Center or our services, feel free to email us at fitness.center@rtx.com. And please note that you will receive a short survey and a link to the presentation slides after the webinar. And please note that this presentation is being recorded for future use. And I will now pass it along over to Dr. Secor to get started. Thank you.
Thank you.
Hello.
Hi, I'm just looking for the slides, which I think you're going to share out. Let's see.
Yes, 1 second.
Sure. So it's a pleasure to be chatting with you guys today. Just as an overview, I put a lot of information in the slides. I've tried to put a lot of the resources and references I use in clinic every day. So if we don't get through all the material, it's okay. You have those references. I'm going to try to allow for at least 10 or 15 minutes of discussion and questions. If we don't have those, I can go back to some of the slides. So hopefully there'll be a nice overview, and then we can get into some of the meat of the areas. And as soon as I get the slides, I will start, or I can open them up on my screen and just share it. So either way. As we pull those up, in full disclosure, my dad was at Pratt for 38 years. So back in the day, we used to be called the Pratt Brats. I grew up here. Most of my family was either in GE. I don't know if we can say that aloud on the screen, but engineers at GE at a variety of places. And my dad, like I said, 38 years at Pratt. So my fond memories going to the airfield for family days, and also having a lot of fun learning about all the stuff that he did. And let's see.
My computer is having a fun time. So would you be able to bring it up on your screen?
Sure. Let me see if I can just bring it up on my screen. Hold on.
No worries.
I just want to make sure I bring up the exact one I sent to you. And that's there. And then I will try to close out everything out. Okay, I'm going to share my screen. And then I'm going to, can everybody see that?
Yes.
Okay, great. And so like I was saying, honored to chat with you guys today. I'm Eric Secor. I help oversee and direct a lot of the wellness activities and integrated medicine for Hartford Hospital. I've been in this space for about 25 years now. I grew up in Connecticut, went to high school here, had a big interest in nutrition and wellness. I went on to do an undergrad at Central, Connecticut State University. And then I did a master's in acupuncture, Chinese medicine. My first doctorate is in integrated medicine, functional medicine, naturopathic medicine. Came back, I did an internship. I did the hospital route. So I worked with St. Francis Hospital for special care. I went to UConn for 10 years and did 10 years of research focused in integrated medicine modalities. I did another master's in public health, and my second doctorate is occupational environmental health. In the last 10 years, I focused at helping to build and define wellness and integrated medicine at Hartford Healthcare. It's a challenge for large organizations like Hartford, Raytheon, UTC, to actively engage in wellness with all of our members. And so I'm one of the folks that really tries to do that for our system. and glad to share some of my areas of interest in the wellness space. Quick overview, again, focusing on some of the big bullets based on what you guys sent me. We're going to talk about stress, about 8 or 10 slides on definitions and different models. I know we all know what stress is, particularly living with COVID the last couple of years. So we all feel stress in different ways. I'll give you some models, a couple of different models, and drill down on the specific roles in healthcare and physical, mental, emotional health. Talk a little bit about the stresses kids are experiencing with home confinement with COVID. A lot of the areas I will focus on, which I use in my practice as part of lifestyle medicine. I am a member of the American College of Lifestyle Medicine, and I am piloting, right before COVID, I was piloting a lifestyle medicine clinic, which I was very excited about starting. And then COVID hit, so we're sort of, it's a work in progress. A lot of the handouts I use in my practice are really focused on the 6 pillars, which is highlighted by lifestyle medicine. And so after we do a little bit of intro, I have a couple, 2, 3, 4 slides in each of these key areas. And so we'll go through those areas, a little bit of research, and then a little bit of, I tried to include a critical handout as a summary, and the handouts do have that smart application for assessment and implementation. And again, any questions, obviously we'll leave time at the end. Make sure you mention it to me when we're about 15 minutes out. And so let's go through some of the acute chronic disease models and some of the basic definitions. So stress, and part of my screen shut off, but that's okay. Stress technically is a force applied onto a material object, or as we think about it, it's a state of mental or emotional strain. And there are a lot of different models out there. I commonly use a couple to engage folks and give them a visualization and what to wrap their mind around. I do like the castle or fortress model, which I modified. So if you think about yourself as a castle, and we have all the walls and windows and doors, and they should represent this semi-permeable barrier. We have to let stuff in, we have to let stuff out. And we know that there are positive stressors, and we know that there are negative stressors. If you build your wall too thick, it's an impermeable fortress. Again, can't let stuff in, can't emote, if you will, and process things. If it's paper thin, then basically you're boundaryless. You have no good boundaries, and you can become overrun by environmental stress, other people's stress, and also your inability to manage that stress. When we talk about optimal functioning of the castle model, basically it represents a lot about stress management. And the way that you've learned to manage your stress is a combination of your development. What were you exposed to as a child? What was the environment? As well as learned techniques. And really our combined capacity for resilience. Resilience is a big buzzword now. And it really speaks to your ability to handle stress and regulate mental, physical, emotional, and your spiritual experience. And so this is one of the models that I commonly use. You don't want the walls too thick. You don't want the walls too thin. You need doors and windows, and really it's about your learned experience and how you manage this whole process.
Hi, Dr. Secor, real quick. We're just seeing the first slide still. I think is it frozen?
Oh, it says I am screen sharing. Let's see. I am screen sharing. Let me stop share. And let me do a new share.
I might be able to do it as well.
Sorry about that. How about now?
Better.
Yes.
Better. Sorry about that. That would have been a long, painful presentation for you guys.
Thank you.
I have lots of bad jokes. I'll try not to put them in. So intro, we talked about that. Overview, this is where we're going, at least in part 1, 8 to 10 slides. this is the castle. Can you guys see that? I know there's a little bit of a delay.
Yes.
Yes.
Okay, perfect. So again, I won't reiterate all this, but the visual is about you being a castle, good stress, bad stress, and that concept of making sure that when we talk about stress management techniques, the idea that your coping skills, if you will, allow you to manage the size of the wall, allow you to process negative stress, take on and process good stress. So this is one of the models that is commonly used. And there are variations of this that we use in pediatrics. Kasia Kolowska has a nice model where we color in different aspects of the castle to identify these barriers and opportunities. Can you see this now, the next slide?
Yes.
Yes.
Okay, another model that you've probably heard of is the idea of the glass of water model, and I'll read this to you briefly. It's a story that has very many different iterations, but a professor was explaining stress management to a class. He raised a glass of water, or she raised a glass of water, and asked, how heavy is this glass of water? And many answers came out: 20 grams, 500 grams. Obviously, this is probably in Europe, not the United States, because it's in the metric system. The professor replied, the absolute weight doesn't matter. It really depends on how long you hold it. If you hold the water for a minute, it's not a problem. If you hold it for an hour, your arm may start to ache. If you hold it for the full day, you may need medical attention. In each case, it's the same weight, but the longer you hold it, the heavier it becomes. And that's the way it is with stress management. If we carry our burdens all the time, sooner or later, our burdens become increasingly heavy and we won't be able to carry on or manage it. And as with the glass of water, you have to put it on for a while and rest, rejuvenate before you can take it up and hold it again. And only when we're refreshed, we can carry on with the demands of life. And so, this image is really about learning how and when to manage stress before it inappropriately manages us. And again, your stress management, your resiliency, and your self-observation is really about this glass of water. We're going to have stresses. We have to self-reflect and learn, when does that stress become too much, and when do we need additional management or to build resiliency. There are other aspects of the biological stress framework I want to highlight. There are good stresses, there are tolerable stresses, there are toxic stresses. And so we think about a good stress as an experience that we can rise to the challenge of. We can take a risk and feel rewarded by a positive outcome. This may be in our work life, this may be in our private life, family life, etc. This is also called eustress, which is a balancing of stress. We go to the next phase, it's called tolerable stress, where those situations where a potentially bad thing happens, but the individual has the healthy brain architecture, that's that developmental stress management, and is able to cope, often with support of experienced family, friends, work colleagues, and others. This is mainly where we operate, and we operate in our private lives, our work lives, and we do need to draw support from colleagues and friends so we can overcome these stressful events. Toxic stress is where that situation happens, where something does bad, something happens. And I saw a little line on the screen, and I'm not sure what that is, but that might be toxic stress, but I think we're okay. Something bad happens, but that individual doesn't have that capacity, that brain architecture that reflects adversely early life events. And they have impaired development. They don't have good impulse control, and they don't have adequate self-esteem. And that toxic stress leads to mental, emotional, physical issues. And so if we think about the model, linear model, we think about stress, we think about the inability to cope, we think about that adverse effects on behavior and our physiology. And what this is an imbalance in that fight or flight response. This is also called higher allosteric static overload, and eventually poor health. I have another physiological model, same paper from McEwen, and this is really the physiological model of how this takes place. Up top, you have stressors. Up at about 11 o'clock, you may have environmental stressors, work, home, neighborhood, etc., major life events, God forbid, trauma and abuse. And so all of those things come in and we perceive stress. Is it a threat? Is it helplessness? How do we perceive that stress? And then about 3 o'clock, we go to that biological response. Is it fight or flight? Are our castle walls too thin? Does everything come in? Do we have the capacity with our learned behavior? Or do we do other coping skills that are negative? Based on that biological response, we have a physiological response. Again, it might be allostasis, where it's a good response, or we may require adaptation. But at any rate, that little yellow at 6 o'clock is the physiological response. And then obviously at 9 o'clock, all your individual differences also play a role. Your developmental experience, some of the genetics, and obviously everything that you learn post early development. And so, this is building on the previous 4 slides, but this is really important because this sets up our physiological response. We have a parasympathetic and sympathetic nervous system. Sympathetic is the fight or flight, running away from the bear, running away from the lion, hopefully not running away from our VPs, but we have a stress response. And then we have a parasympathetic, a relaxation response. And that system is really governed and has receptors in all of our organs. This is that whole adrenal system, the immune system, the metabolic system, and also the brain. And so all of our systems respond to this. And again, our learned activities and what we do with our lifestyle will dictate, is this a good response? Is it a response in balance, that allostasis, or does the response become overloaded? And then does that lead to negative health consequences? Next slide, of course, there are many, many slides on health consequences. I picked up a couple that highlight what are the responses to stress. I've been in the field, about 25 years or so. 25 years ago, we really didn't think about stress, and we didn't really appreciate all the physiological effects of stress. And so everything from headaches, anxiety, that's the WebMD slide on our left, skin, acne, skin conditions, risk of blood pressure, heart attacks. That's the one we always think about. Why do they occur more on Monday mornings? I wonder why. GI complaints, sexual dysfunction, infertility, weight issues. We have diabetes and blood sugar dysregulation. We may be more immunocompromised and more likely to catch colds and flus and have fatigue. Not to compound things, but if we look at the other handout, what do they add? Tension, headaches, skin, I think they talked about that. Diabetes, increased belly fat, reproductive issues, infertility, hair, sleep. I think we talked about immune system. Sympathetic nervous system can change our urinary flow, and also dysregulation of our circulation. So again, what we're trying to understand or appreciate is that the way we manage stress is partly learned, our early environment, but also as an adult and as we join the workforce, it's also about the techniques we learn in our adult life that can mitigate these. So my belief is at any age, even with a family history, even with a non-optimal upbringing, you still have an opportunity to identify these things, adjust them, and then think about your lifestyle and optimize that. And so now I'll do a couple of slides on, again, I think you know this, but some of the, I'll do a couple of research articles about this whole idea of home stress, family life, what's happening during COVID. And then we'll get into some of the lifestyle medicine handouts where we talk about the opportunities for intervention. And so I gave you a couple of ideas of papers. This one was from November 2020. This is the idea about maternal distress, coping with children's adaptive behaviors during COVID-19. And so the concept here is that parental stress, and I added parental, it's not just maternal, it's parental stress, particularly with COVID. We have moms, dads, everybody's working from home. So it should be both parents. So when we're at home, we're really trying to understand what is the parent's role? How is the parent interacting with the child? And does that parental interaction benefit or potentially harm the child? And so bullet number 2, compared with parents with good coping skills, those with higher stress levels and negative coping skills really attribute negative emotions to their children at the expense of their children's positive emotions. So you have a child who comes, you have 2 kids. I have 2 kids, a 20-year-old and a 16-year-old, very different kids, very different coping skills. Although we think they were raised in the same environment, obviously their life experience changes the way they cope and the way that they interact with us. One child comes in, they're very, very negative, they're very stressed. One child comes in, they're very positive, stressed. That parental interaction can make the negative child more negative, the negative child positive, or the positive child negative. And so we understand that the child's emotions can act as mediators between the parents and the children's maladaptive behaviors. Higher stress, poor parenting, negative impact even on positive children. And so what's our goals in the family unit? Identify these things, intervene early, and see if we can not only manage our own stress level, but we have to be very careful what we model and how we interact with our kids. Similarly, when we talk about the impact of prolonged COVID-19 on resiliency and mental health, we know there's been a pandemic. We had a lot of uncertainty on how it's going to last. We don't like uncertainty. We don't like limitations on our control. Whether you're in a healthcare scenario like I am, a high-tech industry like you guys are in, we don't like issues with supply chain. We don't like uncertainty, and we like to know what our locus of control is, and we like to have basically input on that. And so basically, what the questions these researchers were asking was, how has resiliency, how resilient are we in the face of this unprecedented pandemic? And so what they found is that COVID-19 definitely increased distress. It definitely increased depression. It definitely increased anxiety across the general population. We know that kids, again, their emotions are mediators, not only from maternal stress, but also on their kids' stress. We know that those who had borderline pre-existing issues, whether it be anxiety, depression, etc., COVID has been detrimental on them. But we also know that there's been a substantial group that has done very well and has been resilient in the face of these COVID stressors. And so what we're realizing is that, there's not a one-size-fits-all approach across the board. We realize that we need to assess people in an individual way, and we really need to semi-personalize what we do, and of course, identify those at risk and ask the question, how do we help them become more resilient? I think everyone knows with social media, there's a big issue of balance. Social media on the one hand is a great place for information. It's a great babysitter. On the other hand, we realize that there's a huge concern about addiction. There's a huge concern about just hours of daily use. So, this is not the internal research from Facebook, obviously, but the consensus is that as your use goes up, it increases several aspects of emotional burnout: exhaustion, depersonalization, lack of personal accomplishment. So we have to be very cautious about the use of social media. We know that with high school students, we have increased addiction, results in reduced sleep, increased anxiety and depression. We know that there's internet gaming disorders, and these are associated with more psychological distress, poor sleep quality. So this is a big issue for us. When I grew up, it was Donkey Kong, and I think it was Space Invaders, and that was what we started with. And obviously now we have computers on our phone that can bring us anything at any time. So it's just a realization that this is a big factor on top of everything else we have to deal with. The other thing is about, again, the other side of this is resiliency coping strategies, particularly in the workplace. And there's another group who is looking at how do workplaces identify and build resilience. And so there's a lot of research that's looking at traumatic experiences, and it's looking at the positive reactions, and basically that some of these negative experiences, if they're not severe, again, can stimulate resilience and stimulate a feeling of growth. And so basically this study wanted to look at the positive aspects of COVID-19 and the possibility of adding to prevention and promotion strategies. And what they determined was that psychological resilience is fundamental for reducing and preventing the negative psychological effects of the pandemic. If you have more resilience, if you have more coping skills, if you're more adaptable, then you will be less affected and you will have less depression, anxiety, and burnout. It will also develop personal growth. And so basically this paper was looking at, from an organizational perspective, that organizational intervention should really focus on improving workers' adaptive coping skills, resilience, and then long-term, that will translate into a greater promotion of well-being. Okay, just checking the time. And so getting back to that castle wall model, when we start talking about what we do and how we build this resilience, there are several factors, but these are 4 common factors that we want to identify and focus on to build that resilience, build our adaptability. 1, adaptable personality, that positive attitude, accepting of change, that malleableness, half glass full is basically one of the attributes where people will be proactive problem solvers and they will be more resilient. If you have a supportive environment, connections to others, whether it be personal relationships, these are key factors in promoting resilience. And again, it's important to nurture these personal relationships and develop opportunities to provide support to others. Compensating experiences, so compensation experience where you try to make up for a real or perceived weakness, frustration, or desire. These are what we can think of as defense mechanisms. How do we compensate? These can be negative or positive. So compensating experiences are really our coping skills. And there's a lot that goes into building your coping skills or your resilience. I think this one's out of the Yellow Ribbon Reintegration Program, where they are trying to get servicemen and women reintegrated into society after they've had a significant stressors. And they talk about communication, goal setting, problem solving. And obviously fewer stressors. Stressors can be real or perceived. And so if you're being stressed out by the way you perceive things, obviously we can adjust what we perceive, and some common terms: keeping perspective, self-care, stress mitigation, and management. You can put 10 people in one situation and you may get 10 different responses. And again, the idea is the situation stressful to one, may not be stressful to another. So again, there is some individuality about it, but we are always trying to keep people adaptive. We want to support them. We want to have good compensating or coping skills, and we want to identify and reduce our stressors if we can. You know, easy to say, right? As we all know, sometimes difficult to do, but the combination of these will really help you with resilience, help you strengthen your castle walls, and help you identify, am I into a negative stressor? Are they becoming too high? Do I need to mitigate them? And how do I bring in those positive stressors? I know some of you had a little, interest in SMART, obviously applying SMART when we're thinking about goals to manage stress. At Hartford Healthcare, we use Lean. So I do a lot with current state, future state, Six Sigma, identifying barriers, et cetera. This was pretty apropos because SMART is actually one of the acronyms they use in lifestyle medicine also. So when we go through those key lifestyle medicine handouts, there's always a SMART acronym in the bottom where we try to initiate these things. How are you going to specifically do something? Is it going to be measurable? Don't set the bar too high so that it's achievable. Are your goals relevant, not only from a business perspective, from a life perspective, and timing's a big issue. So is there urgency? Many times I will be using a variety of sources to figure these things out. I will do lab work when somebody's worried about stress, or somebody's worried about nutrition, or someone's worried about sleep. I think of assessments in terms of identifying some of these and giving people goals that they can achieve. Similarly, in your area, in the wellness area, whether it's physical fitness, oxygen saturation, weight, those are measurable things you can measure. Then you set your goal up, and then we reassess. I will say the reassessment seems to be an issue with most people. Everybody's gung-ho, we'll do some measurement, and then I'll lose track of them. So, I'm just going to skip ahead. Okay, one last thing. This is one paper I found. They were actually identifying, doing a paper on goal, who is more successful when they set goals for New Year's resolutions. And so, not to belabor the whole paper, but on the left hand figure, these were the New Year's resolutions people were making, and obviously physical health, weight loss, eating, self-improvement, mental, emotional health. The majority of people are doing some type of wellness goal. And so basically, when I looked at this paper, there's very few papers that look at SMART models to extend goals. And so when they use the SMART acronym to extend their goals, basically this represented about a little over 50% attainment of all the resolutions over 12 months. And although that may not seem like a good number, that's a pretty good number. I mean, if you have 3 or 4 resolutions and you can maintain those, 50% of those over 12 months, I think that's pretty impressive. The stats that I use, that if we have a measurable goal and we track, whether it be nutrition or exercise, people are generally about 65 to 70% more successful at attaining a goal if they have some mechanism of tracking their success in that goal. So the next few slides, I'm going to delve into this whole concept of lifestyle medicine. There are many different models out there for wellness. And I've been in this space for, like I said, about 25 years. Our organizations were all looking for what models do we use in healthcare for wellness. There's American Academy of Lifestyle Medicine. This is the group that I've been spending time with the last 4 years. I think all the recommendations are common sense. They can be applied to almost any patient in any scenario with any condition at any stage of life. And so this is a lot of the overarching models I use in my lifestyle medicine clinic that I'm building. So we'll go through a couple of slides per each of these categories. I may not get through all of them, so I may just sort of scooch through, and then hopefully we'll have some time for questions and answers. And so again, healthful eating, this is common, should be common sense. Healthful eating, physical activity, stress management, forming good relationships, sleep management, and that should say cessation of tobacco and avoiding risky substances there. All of these overlap also. So although we're talking about stress management here, if you really are focused on these 6 areas, which all overlap, that will help you build resiliency and manage stress to the best of your ability. So this is usually, so first part again is going to be healthy eating and nutrition. So I do a lot of work with nutrition lectures. Everybody's very confused with nutrition. Every single week, every single day, we hear about dietary fads, and there's a lot of confusion about this. What I've tried to do over time is really boil it down to common sense approaches to what I see are healthy benefits. Obviously, you always have to take into account any specific healthcare issues. So all that overlies these 5 areas. In the center of my nutritional approach, I put the Mediterranean diet. The Mediterranean diet is also the synonym or the archetype for the anti-inflammatory diet. So my focus is common sense nutrition, real food, homemade, moderation, hydration, and low inflammation. So if you look at the top dietary approach, the last, I think, 14 years, the Mediterranean-like diet is usually in the top 5, if not the top 1. The Mediterranean diet, again, is the core, and usually it's the plant-based Mediterranean diet. Really quickly, we'll go around the board here. 1 o'clock is blue zones. Those of you I lecture on the blue zones, this is the areas of the world where people live over 100, relatively healthy. The blue zones is basically the Mediterranean diet for longevity. At the end of the presentation, I added the 9 attributes of the blue zone living, because in this area, they also looked at not only what is the food, but what is the living attributes for people who live over 100. And you'll see things like living with purpose, community. You'll see dietary things. You'll see moving naturally. So again, the blue zones, I think, are another level of lifestyle medicine, but again, the areas of the world where people live over 100, relatively healthy. About 5 o'clock here is intermittent fasting, a very popular idea. We have to be very careful with our patient populations when we talk about the term fasting. I talk with the oncologist. I'm actually at the Avon Cancer Center today, and I remind them that we're not decreasing calories. We are not restricting food. What we're doing is shrinking the time in which your body sees calories. I have seen many people who've seen so many GI doctors and specialists. And what we did for a month is we said, let's pull back some of the consistent eating, the disorganized eating, and let's see if we can just focus this for a month. And we've gotten some nice resolution. Again, 16-8 is the most common. This is where you might eat from 11 a.m. To, what is that? 11 plus 8 is going to be 7 p.m. You're eating your what? Your Mediterranean-like clean, good food during that time frame. And then you're not seeing food until that next morning. Again, you're still hydrating. You can drink tea. You can do other things. But again, what we're trying to do is we're trying to pull back the frequency in which people see their food. DASH on about the 7 o'clock there. DASH is low salt for salt sensitive people. So I think of this as Mediterranean plus low salt. If you have hypertension, issues with salt sensitivity, endocrine disorders, people are very familiar with DASH. It is considered a heart healthy Mediterranean-like diet, lowering salt. Paleo, there's a Mediterranean paleo, again, if someone is super carbohydrate sensitive, they're having issues with insulin, sugar. Again, when we attach the Mediterranean diet to that, most of those proteins will be fish, poultry, chicken. Again, healthy alternatives, nuts, avocado. What we're doing is we're really pulling back all the processed simple carbohydrates. So that's sort of my model of what I use for nutrition. This is the lifestyle medicine handout for overall nutrition. And this will give you a one-pager. And I'm also happy to send you a PDF packet for anybody who's interested. But again, when we look at the bottom, I'm just going to focus on the bottom real quick. Look at your goals: specific, measurable, attainable, realistic, time connected. What foods are you looking to add or change? How do you measure the change? Very often I'll start with 2 breakfasts a week and 2 dinners a week, and I'll do that for the first month. How is it measurable? Do you have what it takes to follow through? Do you have support? Many times in the household, one family member wants to do this, the other family members don't, or the kids don't. So we have to think about attainability in that whole social support. Is it realistic? Again, I don't want someone to go through a healthy dietary change in a week, in a month. We chunk this out and we do small changes over time. The resources are a challenge these days. So sometimes I'll look at the current state, I'll look at the goals, and I'll say, all right, this month our goal is to finish all of our food. And as we replace foods, we're going to think about that Mediterranean-like plant-based area. And as we replace foods, we'll think about what do we want to add. I've given you my primer for the Mediterranean diet. So there's 10 points here you can look at. I've also given you a shopping list. Again, it has to be attainable. Many people take these, they highlight them, or now they go to Whole Foods and they send them to them, or they look online and they start the process by saying, what's on this healthy Mediterranean diet list and what should I be looking at in my shopping list? A big part of the Mediterranean-like diet is herbs, spices, healthy oils. And so I remind folks that all those good tastes in foods don't have to come from salt and pepper. There's a lot of nice spices. And when you start using those spices, you activate the senses, you activate the palate, and then you move away from those sugars and those sweets. This is my hidden sugar list. There's a lot of words for sugar. As you're shopping, again, another big goal for healthcare, decreasing stress is decreasing that added sugar, right? Cardiovascular disease, diabetes, obesity. These are our top 3 with cancer that hopefully 90% are preventable. Decreasing added sugars is another way where we can add value into this area. I also have a little diet list. So those, if we're thinking about attainability, sometimes we look at current state and we run a diet diary out for 2 weeks and say, what are you doing now? And then how do we tweak and make those small changes so they're not more stressful? In the last section, you can go on the internet. There's lots and lots and lots of information. I like these. I was doing a lecture for my Parkinson's folks and dementia folks this past month, and it was all about nutrition. And I really like pictures and figures because I think they say a lot. So whether it's the best foods for your brain, the top brain power, the 9 superfoods, the 8 superfoods, the 5 superfoods, I hope you can look at these and see a trend, right? This is the Mediterranean diet. There, you should see essential fatty acids, fish, avocado. You should see dark pigmented berries, blueberries, blackberries, raspberries, a little bit of nuts and seeds and greens. So again, this is always condition specific. So obviously, if you have digestive issues, if you have issues with any allergies or nuts, you are going to avoid that. But the idea is, if you're seeing these things in your life on average 4 to 5 days a week, then you're getting it done and you're on your way to adapting that Mediterranean-like diet. I hope this is the last food. You can see I'm passionate about nutrition, but I remind people the food has to be real. Again, when we migrate into snacks on the left-hand side, my bias is this is not real food. My apologies for anyone who's, this is your reality right now. I'm trying to migrate people to the right side of the screen and keep them away from the left side of the screen. And that lower picture is the Mediterranean-like diet. Again, there's the Oreo cookie aisle we see, which is now a big aisle in the grocery store. This is the Mediterranean-like diet. I'm going to scoot a little faster because you have all the slides, and I want to make sure we have at least 10 minutes for questions. Physical activity. Basically, the data suggests that exercise is effective in reducing anxiety in people with a current diagnosis of anxiety or stress-related disorders. I am a huge proponent of exercise. Next paper says the same. I'm going to skip over this. I have a physical activity guideline for you, but this slide, I'm really trying to understand, if we use the SMART acronyms, what are we doing for baseline? Exercise is math. And again, we're taking into account physical activity, old injuries, time. But when I work with people, I'm trying to understand, what is your current state? I am a believer in tracking. I am trying to get people to migrate to that 10,000 steps a day, 7 to 10,000. But again, if we don't understand what is your current duration, what is your frequency, and what is your intensity, if we don't have a concept of those, it's very hard to build a fundamental exercise program, because exercise programs are built on math. We're going to start with 5 minutes once a day. That sounds funny. Everybody wants to do an hour, but some of my cancer patients who are getting through chemotherapy, radiation, surgery, 5 minutes might be realistic. And I tell them, add 2 minutes a day. In a week, they're up to 15 minutes. In a month or 2 months, they're up to 30 minutes, 45 minutes. So again, by tweaking your frequency, your duration, longevity, and your intensity, whether it's through your heart rate, whether it's through walking uphill, whether it's on the Peloton, increasing your resistance, these are the ways that you identify your program and change your program over time so you get the results that you need. I have a problem with the thing between my ears, the barrier, the self-talk that tells me, oh, every time I go to do exercise, I have that self-talk. So what I try to do is, show up, shut up, and press the button. That's kind of my P90X acronym that I learned, show up, shut up, push the button. I try to get rid of my self-talk and really focus on the process, which really helps me to be successful. Stress management, this is a huge, this was the fundamental area we're talking about. There are many areas of stress management. Again, there's not one size that fits all. I'll scroll through some of these categories with you. This one is mediational pathways for mindfulness and exercise in mental health, a randomized controlled trial, 2020. What did the results show? That mindfulness-based self-efficacy fulfilled a prominent role in mediating both meditation and exercise program benefits. What is our findings? Mindfulness and exercising training share similar mechanisms and can improve global mental health, including our adaptive response to stress. High-end athletes I see, they're all into mindfulness, they're all into meditation. We know when our brain is in the present, we are able to achieve our goals, and also we are able to actually improve our outcomes in exercise as well as the adaptive stress response. MBSR, I apologize, is mindfulness-based stress reduction. You may be familiar with this. This is a large program by John Kabat-Zinn up at UMass. I think he just moved to Brown. This is an 8-week program where people can learn mindfulness-based stress reduction. I also use Herbert Benson's program, which was his mentor, which I'll allude to in a minute. Again, yoga, I'm just going to go to the results. This is in working women. They did yoga sessions weekly at work for 16 weeks. They looked at stress and anxiety, significant improvements in cardiac functions, anxiety score, and finger dexterity improved after yoga training. That's exciting. Low potential cost, high potential benefit. Mindfulness on the go. Again, I think this is the UK. This is the use of a mindfulness app. And we have a smart app we're working on and working with, which is great. They looked at about 240 employees who are otherwise healthy, and they randomized them to practice on the app or a waitlist control. They did 10 to 20-minute guided meditations, and they were asked to do this once a day for 8 weeks. And so on average, this is important because on average, people did about 17 meditations. So not a very high volume. And I think when I looked at this, maybe I didn't put it here, I think it also averaged about 10 minutes a day. So they saw significant improvements in well-being, distress, job strain, and perceptions of workplace social support compared to controls. And so what this is suggesting is that I think even 3 times a week of a 10-minute self-meditation can improve your outcomes at work. This is another mindfulness program. I'm just going to say that this is that 8-week MBSR program from John Kabat-Zinn. What did they see? Improvements in self-reported mental and physical function. They saw reduced pain, and they saw reduced psychological symptoms and improved self-efficacy or resilience. They also saw this 1 year. So they also saw, they evaluated this at follow-up for a year. They saw a 50% reduction in primary care visits, specialty care visits, emergency room visits, and hospital admissions. So if you're self-insured like we are, this is something that we want to engage in a meaningful way, help support everyone in our employees. And by the way, we actually may reduce costs. So we can take those cost savings and put them into workplace wellness for our staff so we can get more cost savings. I see that I'm almost running out of time. And Elena, I don't know if you have questions that are building up, but I'm going to just scroll through. I have a handout for you on stress management techniques from the lifestyle medicine. I also have a handout for you on the benefits of diaphragmatic breathing and everything that it does for you. When we talk about relationships, I have a handout for you on maintaining and developing your social connections and strengthening them both at work and at home. Again, what are you looking to do? Be specific. How much time can you do this in? Over how many sessions? What does it take to follow through? We know that new social connections and strengthening your social connections do what? Strengthen your castle and improve your stress management capabilities. I've also put something in from the lifestyle medicine about what we can do with our young kids. And there is a little kit about a calm kit, behavioral coping that you can refer to. Obviously, kids are not just small people, they're unique. That's that commercial from Children's Hospital. Sometimes it is not clear what they're stressed about. And obviously the way they emote is sometimes through acting out. And so we just have to realize that some of their change in behavior may really be underlying frustration, lack of communication, and lack of proper outcomes on how they can manage stress. So this hopefully will give you some resources there. And sleep, needless to say, sleep is critical. It affects athletes, it affects the general population. If you have restorative sleep, you are more efficient at everything that you do. I have a handout on your sleep disruptors, on your tips for better sleep, and your goals for sleep management. Many people I see, and we all experience sleep disruption with increased stress and anxiety. So it's important to regulate sleep just like we regulate exercise. I'm going to pause a second there and see if Elena has any questions built up, or if I should continue for 5 or more minutes.
So we did get a couple questions in the chat. One of the questions that we got was, do you have any or do you know anything about energy drinks, and what's your opinion on the Bang energy drinks? I know it says there's super creatine and aminos and the Ultra CoQ10. What's your opinion on those?
So it's a really good question. As part of my nutrition piece, I do a whole separate piece on sports drinks, sports optimization, dietary supplement safety. And so I'm very, very, very cautious. I generally first will ask the question, why are we using them? Many of the prepare sports drinks, I see young athletes, I see high school athletes, college athletes. Many of them have speed or speed-like caffeine-like substances. And so I'm very concerned about our young athletes because they're going out and they're being told before football or before matches to take, pre-workout. Well, pre-workout has guarana, caffeine, many different things in it. And again, it's one thing to have a cup of green tea or a cup of coffee. It's another thing to ask these young people to preload this. So I am concerned. In the top 4 areas of side effects with supplements is sports, and weight loss and sports are the 2 areas where there are the top side effects. And again, we can't say that the sudden deaths of kids on the field are related to this, but many, many, many of them are having these drinks. And guess what? They're also having insomnia and they're also having anxiety. So I remind them it is caffeine, and many times it's like 3 large Starbucks coffees. So I make custom smoothies for people with real food. I don't mind some extra protein powder. I don't mind an extra multivitamin. I don't mind some anti-inflammatories. But be very careful and know what you're taking on the sports medicine side, particularly if you have any pre-existing conditions. Next question.
All right, we have, do vegetarian diets worry about B12 vitamins?
Excellent question. I see vegans and vegetarians every single day. I remind people that the GOAT, right? Tom Brady is a vegan. I'm sure Tom has a wonderful chef or a group of chefs and self-shoppers that is preparing everything for him and the family. Vegan and vegetarian really prevents diabetes, cardiovascular disease, obesity. The questioner's point, we do see B12, B1, iron, ferritin deficiencies. There are good vegan sources of iron. So I have an vegan, iron-rich food handout. But I usually test a couple times to get a baseline. And so it's hard to guess at what your B levels are. Your standard GP or maybe the wellness through Raytheon will do some labs and look at your CBC. For my vegans and vegetarians, I will look at the CBC, which is your complete blood count, red blood cells, white blood cells, hemoglobin, hematocrit. I will add B12, iron, and ferritin to that. And very often I will add fat-soluble vitamins. Many, many people are deficient in vitamin D and A, as you well know. I don't know why insurances feel the need not to pay for that. It's critically important, particularly with our vegans and vegetarians. So I think the answer is yes. Test, be mindful, and get your combination of proteins in your diet. I think we have a couple more minutes. Next question.
All right, how about, what is a good technique for when you're in the moment and you feel stress rising and can't seem to do anything?
So I advanced my screen to the Herbert Benson 5-minute relaxation response. I also put my hand out for the 5-minute relaxation response. Every single person I treat, I try to introduce breathing techniques. Herbert Benson has been studying relaxation response since the 50s. He's actually John Kabat-Zinn's mentor. Identifying when you are getting stressed is one of the most important beginnings. Part of the stress response in that sympathetic stress response is increased heart rate. When our heart rate increases and we breathe shallowly, the brain says, I don't have enough oxygen. And that begins the sympathetic stress response. The most important thing you can do immediately is stop, count to 3 in, count to 3 out. So, this is a whole guided imagery thing that I teach people. You don't have to do all these parts. just stopping, putting your hand on your belly and your chest, counting to 3 in, counting to 3 out, doing that for 3 to 5 minutes tells the brain, I have lots of oxygen. I don't have to be stressed and anxious. Nice thing about that is you can do that wherever you are, in a business meeting, on your way to a business meeting, sitting in the chair at the doctor's office at a red light. So again, this is something I practice, and back to that Qigong breathing, many of us do not breathe. We don't breathe slow, we don't breathe deep. So this is one of the things I teach everybody, and I encourage. It doesn't have to be esoteric, hokey, it can just be breath work. But again, practice makes perfect. We have time for one more.
Okay, so this one is, what are your thoughts on the keto diet?
So I had paleo up there. Keto is very challenging. Again, keto, for those of you who don't know, we're pulling back the carbohydrates to a very, very, very small level. And when we pull back the carbohydrates and we focus on essential fats or dietary fats and proteins, our body will metabolize those and produce ketones. And so in the short term, we're looking at some potential benefits. I have seen a lot of negative effects to the keto, to that diet, because once you get down below 25 grams of protein, this is only 100 calories. Think about that. You can have decreased concentration, fatigue, disorientation, and many of our cancer patients who were trying to get into this had some significant side effects. So again, it's one thing to be paleo, pulling back those simple carbs, focusing on clean proteins, clean grains, quinoa, a variety of vegetables. But I think there's some issues long-term of pulling back your carbs so drastically and so low. So, you know, I tend to lean on the Mediterranean paleo as opposed to the keto.
Awesome, thank you so much.
So if that's, I think, all the time we have, everybody will get copies of the slides. If there's additional questions, feel free to email them to me. And if there's an interest in any of the lifestyle medicine PDFs, let me know. I'll be happy to send those to you.
Awesome. Thank you so much, Dr. Secor. And yes, everyone, there's a link in the chat for a survey for more questions. If you have any questions specifically, we'll pass them along to Dr. Secor, and everyone will get a recording of the presentation and the PDF slides as well. Thank you so much for your time today, Dr. Secor.
Have a great week, everybody. Be safe. Bye-bye.